Good evening, everybody. This is Board of Health meeting beginning, today is 7th of March. Excuse us for starting a little late at 6:35. Calling the meeting to order at 6:35. Before we go to public participation, I'm actually going to reverse this a little bit tonight, just to go right to approval of the minutes from the meeting for February 21st. Do I have a motion to accept the meeting? Motion to accept the meeting minutes from February 21st as written.
I'll second that motion.
All in favor?
Linehan, aye.
Silver, aye. Borgo, aye. Great minutes, by the way, very busy. We're going to, I want to vote to go into public hearings. I imagine we generally do. Is there any general public participation that does not have to do with Body Works? Were you all here for the public hearing on Body Works or something else?
No, I don't think anybody's here for Body Works.
Okay. So seeing none, can I take a motion to open a public, well, it's not it's a public hearing, we're not in the field. Right? Do I have to open it?
Yes, you still have to open it.
Yeah, I gotta open
for
it.
participation
Hearing.
about Body Work. Yep.
Yep. So I'm gonna ask for
Is there anyone on Zoom who wants to talk about Body Work?
Okay. Yes, so there's a few people on Zoom. Okay, there's Julie's raised her hand, Julie Scott.
does Julie want to talk in general, or does she want to speak to, she has an opinion on two of the issues ahead?
I wanted to just speak in general, and then you can begin the body work stuff.
Okay,
Is this participation for Body Work?
this is public, no, I'm in the very beginning, I'm back to
Okay,
number
okay.
one, public participation. Shoot, Julie, go ahead.
Hi there, Julie Scott, 4 Central Street, Wakefield. I went to the planning board meeting last night, and all the legal requirements have been met for the zoning of the marijuana overlay district on Audubon Road. I've been writing to a bunch of community organizations as well as you and elected officials about my concerns about the Cannabis Control Commission and its complete disarray and lack of organization. And you, as a board, would be working directly with them. I was listening last night, and the big selling point was about the taxes and how the taxes can help the community of Wakefield. They have a 10.75% excise tax, state excise tax. They have on top of that, a 6.25 standard sales tax, and then a local tax, which is optional up to 3%. And then a community impact fee tax, which is up to, I believe, 3% also. Studies are showing around the nation that because legally sold marijuana is so highly taxed, it's what's fueling the growth of the illegal marijuana trade. It's so much easier to buy illegally grown marijuana because it's half the price, sometimes even less than half the price. I'm concerned about that. The state is not consistent on its marijuana testing. The state is not consistent on employee stringent guidelines as far as their employees. There's a lot that's going on within the commission itself. There's not one full commissioner who has been there for the entire 5 short years of this commission's life. So what's happening is around the country, the illegal marijuana trade is actually selling about 68% of the marijuana in the country. And I supported the legalization of marijuana for a lot of reasons having to do with policing and with the court system. And I believe that people should have the choice to use marijuana. I certainly support the use of medical marijuana, but if you're going to grow it in this climate, what I'm learning is that purchasing marijuana, even at a dispensary, when you don't know how strong it is, where it came from, what chemicals are still on it, mostly who actually grew it. Most of the illegally grown marijuana in the country is grown by Chinese growers throughout a lot of the 50 states, including Massachusetts. Oklahoma is filled with it, wrought with it. California, Oregon is having a huge issue. The state of Maine, 2 U.S. senators up in Maine wrote a letter signed by 50 members of Congress, sent it to the Department of Justice at the end of February, begging for help and information, and they included Massachusetts in their letter. They do not know how to combat the illegal growing. There are more than 300 illegal growing sites in the state of Maine, and they are selling here in Massachusetts. So I want to reach out and work with people and present the opposing view. Not because I'm against marijuana. I'm against illegal marijuana. I'm against marijuana when we don't know where it comes from. I'm against using taxes off of people who may have issues and thinking that's what's going to make our community better. That strikes at my heart. I would love to work with WAVE or any other groups who might be interested in presenting an alternative point of view at the town meeting. I think the town meeting is going to be very long this year. It might go up to 3 nights, maybe even 4. So I just wanted to let you know that I'm there. I'm concerned. I'm willing to join in any conversations that anybody would like to have. And I just wanted to fill you in, and I'll keep emailing you. I'll try to make the emails shorter, but please make sure that you share the emails with everybody on your board and anybody that you know of that would be a concerned citizen. Thank you very much.
Thank you, Julie. Man, you almost made it into 3. Good job. Okay,
Thank you. Bye-bye.
very much. Okay. Can I have a motion to start the public hearing on body work regulation
You want to do
changes?
minutes
I know, I got.
Sorry, I have a question. If we wanted to speak about something other than body work, do we need to do it now?
Yes,
Okay, so I think we all have some.
So just a point of order, this is,
is this about cannabis?
no, it's likely about the nicotine-free generation. So it's,
So okay, interesting. So we've already had our public hearing around this. We have not yet deliberated as a board. You're all here.
so just a reminder, the public,
Yeah.
the board voted for a 30-day comment period.
Yep.
posting.
Yep, so, comment period is closed. We actually continued to get comments up until last week by email. So I do think that we cannot entertain a repeat of that same public hearing. I think we heard everything. And so what I'm going to suggest is that we listen. If someone could give me a 1-minute synopsis in general, but we have had an extensive public hearing meeting. We have not discussed it as a board whatsoever since then. We have all the information that we've been gathering with letters. And so we're not going to have we're not going to redo that public hearing. Does that make sense? I don't think there's very much more. And I think the public deliberation should be interesting. Whether or not we have any kind of vote tonight, we're gonna see. But we have a public on the agenda right now. We have public hearing for body work regulation changes. Do I hear a motion to start that public hearing?
I'd motion to open the public hearing for body work regulation.
Second the motion.
All in favor?
Linehan,
Silver, aye.
Corbett, aye. The public hearing is open on body work regulation changes. Is there anybody who is here to speak to that topic?
I can't tell if Julie's raised her hand to speak on body work or if she, Julie, are you speaking on body work as well?
She may want to talk about it.
Okay, she may just have her hand raised from before. Okay, I think we're good.
Right, seeing no comment either on Zoom or in this room, we'll close the public hearing and we'll proceed with just going through the body work regulation, one change at a time.
Okay.
All right, Anthony, do we have a full regulation?
We can share it. Okay.
You have a copy of the existing body work regulations.
That's
These are just the
The
changes.
changes, so the whole thing.
It is posted online.
You posted it.
Yeah.
What day did you send that to us, Cindy?
This would have been from last.
last month. This is last year before this. Oh, I think I actually included it in the packet.
Oh, yes, you did. Okay, so.
But it's also.
No, I got a lot of the last 2 days. Here we go, meeting agenda, edited, nope. Attached, yes. Got it, okay. So track changes, and then the second one is
Is that the original?
the original. Yeah, I would have. I would suggest when we ever do this again, that you just do the whole thing with the track changes in red in the body.
Yes.
So the only reason we didn't do it this time is because
So much
we
different.
changed the table of contents a lot, so it ended up
Okay.
shifting the entire document. to the
Yeah,
whole
I
page.
just-
I remember.
All right, Anthony, go, start talking. I'm gonna just try to find what.
Okay.
Cindy, you did not send it. You
No, I
sent,
didn't, the original, might have been last month.
Well, if you have internet, if you look up Wakefield bodywork regulations, it's the first one.
Okay.
Yeah.
no, actually, it's,
You just pull it off the state.
I'm gonna pull it off. I'm gonna pull it off
The
now.
town website.
Yep,
Okay, so is it
keep
okay?
going, yeah.
So I'm actually gonna just skip over the table of contents changes, because it really is just a change reflecting the stuff that we added, so I'll go over that at the end. So in section 2, under purpose, we changed it to the Wakefield Board of Health finds it necessary to permit the practice of body work and public health and safety of the community, including patrons, employees, owners of commercial businesses offering legitimate services. The scope of these regulations is broad and includes many aspects which, if not clearly regulated, could endanger communities and constitutional human trafficking in these. Are there any questions about section 2? Purpose?
There we go, sorry. Okay, yes, no, got it.
Oh, okay, so, in section 3, the only major change was the adding of aromatherapy to the definition section of services included under, but not, limited, but not, including, but not limited to, section of services. Under section 6, the requirements for obtaining and renewing body work establishment permit. We added subsection 2, a permit issued to the operative establishment, a permit or permit issued to a professional or student practitioner body work, or a permit issued to conduct solely off-premises business is not transferable to another location or person.
That's correct.
Good. Added number 3, which was applicants for a body work establishment permit must provide proof of liability insurance with a minimum coverage of $1 million, as well as workers' compensation insurance.
This is brand new, so this is added.
That's correct, yeah. The applicant shall submit a high school diploma or its verifiable equivalent. That's 4. Number 5, applicants for a body work establishment permit shall provide the name or names of individuals that are currently certified in CPR, and a copy of their valid certification form. One individual trained in CPR must be on site at all times during operating hours. Subsection 5, in addition, the examination report shall include whether a TB screening is indicated, if indicated, a written negative result obtained. Section 7, file an application for renewal not less than 30 days prior to the expiration of their permit. A bodywork practitioner shall provide the department a completed renewal application, including a new Massachusetts physician's, we were going to adjust the physician's letter to clinician's letter. As specified in section 6.5, a new quarry acknowledgement form, annual license fee, and an updated front-facing digital photo to be posted with the permit as renewed if granted. The fee for each permit renewal shall be in accordance with the most recent Wakefield Health Department fee schedule.
So, do you wanna, can we just interject as
Yes, please do.
we're input rather than trying to find this and tracking them? So you said some clarification in regards to physician's letter, you have 2 nurse practitioners on your board.
Yes, so we're gonna
So you're
change
gonna change, how, what's the language you're gonna use?
we're gonna change that to clinicians,
I would just say licensed,
licensed clinician.
medical. The right term? Sure. Is it?
Healthcare provider.
A licensed healthcare provider.
The licensed healthcare provider. Okay, so-
I also have a question about section, the second added section 5 on the previous page.
Okay.
I wonder if we're gonna run into trouble if somebody has like a positive quantiferon test, but then they don't have active tuberculosis. I wonder if we want to be specific about like, do we need to have evidence of like a negative chest X-ray or like a treatment with a tuberculosis clinic? Because I feel like we, especially many of these folks maybe born
Yeah,
outside the
with
United
endemic.
States.
Yeah.
Most will,
Yeah.
most physicians and most TB clinics now will, if you have the positive and they've done the follow-up, will issue, and health departments will also issue to the person if they've been under their care, that they are now free.
I
Right,
agree,
so,
but I
but the
think
wording,
Yeah, but
it's
what-
negative
but you-
result,
yeah.
which
Or-
we're not gonna
well,
have.
and what I
Yeah.
would write is,
Or proof,
TB
no
treatment
active-
review.
yeah,
Yeah,
a proof of inactive disease or previous treatment.
yeah, exactly.
Alright, so how do you say that fast?
Sometimes they ask for negative chest x-ray.
Yeah.
So what I'm wondering is if the language might be better, so, all right, hold on. Shall include whether tuberculosis screening is indicated, and if indicated, a written negative result obtained.
Isn't it always
If
indicated?
indicated, yeah. So this is the process.
Right.
Is that, healthcare worker was exposed 40 years ago. Did their ionizing, whatever else the treatment was at the time. Forever, you're not supposed to ever do a skin test. Quantiferin is now the new standard. It's expensive. And usually there's a symptom review. I'm just wondering, since we're being, we're really tightening this thing up,
Yes.
might this be, so I think we can just sort of talk about unintended consequences or, the aftermath of what we're asking. And we have our public health nurse here and our expert here. Can we then defer to, maybe a TB review by Wakefield's public health nurse? Because it keeps it in-house, it's one step shopping. Tuberculosis is still the purview of public health nursing. And then we're not having, diving people somewhere else, does that make
And
sense?
she would be able to initiate the screening, the TB screening on
Yeah.
you. And then she would just sign off with that and it would go on the record.
How are we gonna write that?
You could say like, review would be necessary by the public health
Yeah.
nurse
Yeah.
if history
Yeah.
positive.
So,
Any positive result would need to be reviewed by the public health nurse.
It shouldn't, I think if you take out the word, shall include a TB screening and,
And public health nurse review for any
Yeah.
positive result.
yeah. And review by public health nurse.
and reviewed by public
Yeah.
health.
Yeah, does that sound right?
Period. I think public health nurse, I mean, how many applications are we gonna get?
Yeah.
So
Well, everybody,
sorry.
right? Everybody has to do
Well,
this now.
anybody who.
Yes, anybody who works.
So you're gonna get, every employee in Wakefield is gonna now
How
have to
many
do
is that
this.
gonna be?
Probably a lot.
How many
We
employees do we have right
determined
now?
that there were approximately 6 to 8 establishments.
What, 10 to
each
20
one could-
employees?
No, there are 2 to 3 employees
Oh,
at
okay.
most.
And this would be rolling, like we have to make sure we don't have an undue burden. But it seems to me this is,
Well, we have a built-in, well, at the end, we'll see we have a 60-day built-in grace period, and we still have discretion at the end of it
okay.
if there's still process to go through.
What I'd like to see is, I don't know if you've done it, like what the new application's gonna look like. I think it's like you take this and like, what does that application actually look like?
Yes.
And can we make sure, and I'm getting ahead of myself, but can we make sure that when someone comes for a business permit at town hall, that they don't think that's it?
Oh, I think it's very good, so we're
Yeah.
changing the workflow so that the
Good.
workflow application will now include clerks. It's the building department will include us, so we'll have that built in. So-
Okay.
Thank you.
Oh, this is fun.
Can I just confirm one more time, so, or even as is, and then including any positive result would need to be reviewed by the public health nurse, is that correct?
I would
I
say
think all applications have to be reviewed.
by
the
her
public
and a
health nurse.
follow-up if indicated. So when your public health nurse does your screening, if there's a follow-up she feels according to DPH, then she will do that, and then that person will have to come in with a letter stating.
Yeah, the public health nurse can guide them through the
Yeah, she
process
can
of
do that.
reaching out to their
Yeah,
PCP
much
team.
easier.
I do.
Okay,
Thank you, Melissa.
Going on the work.
Glad you came.
Going north today.
okay, perfect, so, okay, so we have that added, section 7, we struck physician's letter and changed it to licensed healthcare provider.
Yeah, licensed healthcare.
Or licensed healthcare provider,
Yep,
is that, okay,
yes.
perfect, okay. And then I'll just keep going, but just stop me when you have.
Yep.
Section 8, any bodywork practitioner permits not renewed by the 31st day of December of the present year shall be administratively suspended. Such a permit may be reinstated if a completed renewal application of the late fee according to the Wakefield Health Department fee schedule is received. Any permit not renewed by the expiration date shall be deemed a retired permit and it may only be reinstated upon approval of a completed application for a new license.
Wow, we have a 15-day, 3-day grace period.
I kind of feel like business day is also important. That's New Year's Eve.
We do see it coming,
And
ahead
they're
of time,
getting
though.
these emails from the state also, right? Is this like,
It's not-
it's not like the dumpster
All
fire thing,
out.
right?
Oh, it's a strictly local.
Okay.
regulation.
They're not getting, but are they getting emails from us, and from another, like, body where they submit their application or
Just the permitting system.
That's,
The
that's the
permits-
whole
If they
point.
have. if
So the
they have an
system
existing-
and you?
Me and the system, if they have an existing.
Okay, so
All
they're getting
the time.
emailed by two.
Yeah.
different-
Yes.
Yeah,
right.
but the whole reason why we have body works regulation is because there is no state oversight.
Oh, well,
No, I get that. yeah.
You're saying it's just like, from a logistics standpoint, you're getting an email from OpenGov, which is our permitting
This
system.
is what
and
I'm
also
I-
getting
trying to
emails.
clarify,
Okay,
yeah.
thank you. Okay.
Yes. So it's not just one
We're
person sending
getting, like,
one
double.
email, like,
Yeah,
this
yeah.
is coming.
You can reapply early, right? When is the
Oh, yeah.
application?
I usually open up like November.
So starting in November, you can start renewing, we can renew as early as November. Okay, so it's section 8, okay?
Mhm.
Okay. Section 8F, changes display in a conspicuous place the current permit of the establishment and current permits of all bodywork practitioners conducting bodywork therein.
And that's a permit from us.
Correct, yes. 8H, file a renewal application not less than 30 days prior to expiration, whereupon the existing permit shall not expire until the Wakefield Board of Health has finally determined the renewal application status.
So, it seems okay, so this is like a 2 chance, like, you better get it in 30 days ahead of time, you better not be late. So the first one is,
So this is, the first one is the
So-
practitioner permit, and then this
oh,
yeah.
8H is the establishment permit.
oh,
So there's two permits.
oh,
So in other words, the practitioner, as long as they're licensed, they're okay. If they lose theirs, it's okay for the business to still go on and renew their license.
That person can't work until they.
Yeah.
Okay, so section 8I, every establishment shall have one or more managers who shall be responsible for ensuring the establishment, all practitioners and clients comply with all requirements of these regulations. And such manager shall be authorized to act on behalf of the owners at all times of the establishment of the business. All managers must be permitted bodywork practitioners and may also be an owner of the establishment.
what's the rationale for this one?
So this one is, they have to have, it's similar to a restaurant, you have to have a person in charge that is knowledgeable, that
Yeah,
can enforce food safety. So similar here. Section 8J, we added apprentices and studentships are not permitted. Section 9, at no time shall a bodywork practitioner conduct or run a business from a residence, condominium, hotel, motel, mobile home, or other residential setting defined by the Board of Health. So essentially no offsite.
you know, it's interesting, because massage therapists can, I get it,
Right.
but I'm just always looking at the other side, which is, you know, people can do that in other businesses. I'm fine with us being very, very careful in this regard. It's gonna happen in non-permitted ways, what's gonna happen. So.
That's why we have this. Okay, section 7, requirements and standards of bodywork establishments. So we added number 1, all rooms used for bodywork shall be equipped with a door and have at least 70 square feet of floor space. Add section number 2, all rooms used for bodywork shall not have doors with locks nor capable of being locked in any way. Number 3, establishments must remain closed within the hours of 10 p.m. to 8 a.m. Section 4, establishments shall maintain a written record of all services that include the date, the name of the client, the bodywork practitioner providing the service, the service provided, and the charges imposed in adherence to standard business practices. These business records shall be kept for at least 3 years. Section 5, no room or section of establishment shall be used as a bedroom for sleeping purposes or as a domicile. Section 6, every waiting room area must be lit with a combination of natural and artificial lights. Blackout curtains, other light prohibitive shades, or window spray.
This is a big change.
Yes, correct. So this would take away any shades, any other kind of obstructive measure to not be able to see. A sink with running hot and cold water, minimum hot water temperature of 110 degrees must be located in an easily accessible area within the permitted establishment.
That wasn't in the original?
Don't believe so.
Okay.
Section number 8, sanitizing chemicals equipment on site must be labeled with the ingredients it contains. All furniture and equipment in each room shall be kept clean and sanitary at all times. Number 9, restrooms must be made available to customers and employees and shall be located in an easily accessible area within or near the permitted establishments.
Do we need to include that they should be ADA
Building code, but we could, we're a little redundant here anyways, to building code, we could add it if that makes sense.
Well, we don't want to do this again. So I don't know, I mean, I'm just, I'm just trying to be fair, like, so let's just look at our under state license, we have a lot of esthetician things. I'm not sure that it's required that they be ADA compliant. I think it's nice if they are, but plenty of people on the second floor.
This is like number 15 here, establishments must comply with the town of Wakefield.
Oh, okay.
Yeah, I think
All right, so that would be
that'll
redundant.
be
Thank you.
covered.
Read ahead. Okay, thank you.
Good catch.
Getting well, I'm saying. That's a nice job, getting as good as this thing. Okay.
Okay, so section 10, non-disposable instruments shall be sanitized after use on each person in a manner sufficient to maintain cleanliness. No equipment or instruments shall be applied directly to the skin of a patron unless sanitized prior. Number 11, robes, towels, cloths, or other linens which come into direct contact with the bodies of patrons shall after use and before reuse be laundered in such a manner as to ensure effective sanitation. Non-latex gloves must be available on site. If latex containing products are to be used, a sign should be conspicuously posted stating all clients are advised that latex containing products are in use. Section 13, no items of sexual nature may be stored or displayed within the establishment or on the grounds. 14, establishments shall not install a shower or other amenities that would allow for the employees of such establishments to live at the facility. And 15, establishments must comply with town of Wakefield. Section 8. Number 1B, no permitted practitioner shall use a practitioner-client relationship to solicit for or engage in sexual activity with any client, whether consensual or otherwise, whether within or outside the bodywork establishment, or to make arrangements to engage in sexual activity with any client.
I think more clear than that.
So 1C, disallow any and all legal acts on the premises. A violation of this section may be grounds for revocation or suspension of establishment permit.
No drugs either.
That's
Or any.
that should be included.
I know,
All
I
illegal
know. Being kind of, just to be perfectly clear, this is what we worry.
At no time shall a practitioner of bodywork therapy conduct any business or list as a business his or her address. Additionally, at no time may clients be seen at the bodywork practitioner's residence or run a bodywork business as a door-to-door enterprise. Bodywork practitioners must wash their hands with soap and water immediately before and after administering services in person. Practitioners must ensure all clients are properly clothed in appropriate attire or draped with clean towels. H, practitioners may not perform services they are not specifically licensed to perform, such as diagnose disease, perform joint spinal manipulation, perform acupuncture, or other. In addition, practitioners shall not operate equipment they are not trained or licensed to operate, such as X-ray, fluoroscope, diaphragm.
What is that?
Totally familiar. Or other similar equipment.
Maybe, we should know, right? It's in there.
Yeah, probably know what it is.
I tell my kids they shouldn't use a word unless they know what it is. So,
guessing that would be it.
The therapeutic treatment that uses electric currents, radio or sound waves to generate heat in layers of your skin below the surface.
Oh, like electrical
It's-
stimulation.
Or ultrasound.
Well, thank you, I learned something today.
We all have. Section I, practitioners may not use or allow patrons to use alcoholic beverages, illegal drugs, illicit drugs, marijuana, whether for medical or recreational usage or controlled substances on licensed premises. Practitioners may not administer massage unless the individual is properly licensed by the Massage Board of Registration of Massage Therapy and the premise at which the massage occurs is similarly licensed by the Commonwealth for the conduct of massage.
Getting back to. It's an indoor establishment, there can't be smoking. Can't be tobacco
Covered
smoking.
under smoke free.
It should, but. I just wanna make sure, and you know, we're double covering everything. It's also it said the smoke-free workplace under zoning as well. Or building.
it's supposed
Under
to
building,
say-
no
Smoke-free
smoking.
workplace law covers any
Everything.
place where the
Okay.
public can go.
All right. We don't wanna go backwards.
Okay, so was there any change that you wanted to make to I?
Just wanted to make sure that.
Number 9, inspections. We added establishments are subject to inspection by the department or its authorized agents during all times of operation. A minimum of 2 inspections are required over the course of each calendar year. Number 2, denial of access to an agent of the department shall result in the immediate administrative revocation of the permit to operate a bodywork establishment. 3, if upon inspection, conditions are found that do not comply with provisions set forth in these regulations, both the operator and any bodywork practitioner responsible for violating these regulations may be subject to enforcement proceedings and penalties pursuant to Chapter 11.
Did you want to mention whether or not these inspections are scheduled or unscheduled? Does that matter?
We can clarify they're unscheduled.
One other question, when you ask for all practitioners must have, I'm sorry to go back to a valid form of identification on them. Are you doing an ID from the employer with a picture ID, or are you gonna take a driver's license or something like that? Driver's license.
So all practitioners also have to undergo Cory checks, Cory surveys.
The whole, the whole,
Well, it's not,
how do you get an ID if you're not, if you're not a
Well,
citizen?
you need to have Cory, so you
yeah, we do the
Right.
Cory.
you have to have at least a state ID.
Right,
Right.
right, yep, yep.
Okay, we're on section 4. The final one of this group, reinspection shall take place when an establishment does not pass inspection. A reinspection fee as determined by the board may be required if corrective action is not followed. Section 10, advertisements. Establishments and therapists shall be mindful of professional ethics when placing advertisements as used in this section. Advertisements shall include, but not be limited to, service offerings or promotions in or on newspapers, periodicals, television, radio, any form of print media, or any form of internet or web-based marketing. Advertisements that appeal to prurient interests or advertising in a manner that uses exotic, sexual, or provocative language and or pictures to promote business may be construed as a breach of proper standards of bodywork.
Maybe or would it?
Well.
I think maybe, again, I think maybe gives us more discretion, but would.
Yeah, are we in the application? Getting to this, but are we having them submit sample advertising as part of their application?
I think
We
we're
can
gonna,
do that. We can have them, services. Submit your services as like we do with establishments, we make them submit their menu.
Yeah,
Submit
I,
your
and
services.
I can see that, and I think Erin did the bulk of the work on this, did she, or?
Dan.
Dan,
Dan and everything.
yeah, Dan, Aaron, and Yana all worked on this, yeah.
So, you know, you can, You can see, yeah, good, thank you. So you can see that, like finally we have some kind of hair, like we kind of have this model and structure where you can make a comparison. When we first did this, it was new territory. We didn't, it was a new business model. We didn't, so it sounds like people have been tweaking all along and your team pulled up, we're like bumping to back to best practices. Okay.
Yes. We'll also, besides the menu of services, we're also going to be asking them on the application to provide whatever direct website they use to, that would be helpful just for us to know what they're, because we can't control Yelp, we can't control their places, but like actually directly their website would be asking for.
It was interesting, Julie Smith had some, no, not Smith, sorry, Scott, was even saying, like, we can't get everybody's phone numbers and how then he, correct me if I'm wrong, but it seems that, it's the phone, the phone number on the application has to work. We have to be able to get a hold, so I don't know how many secondary phone numbers we get, but.
A lot.
We do.
Okay,
Quite a few.
excellent, thanks.
Okay. Number 2, any person who is not permanent, actually, did I read this one? No, okay. Any person who is not permanent in the manner described herein may not represent him herself as being permanent or licensed bodywork practitioners, or hold themselves out to the public as being permanent or licensed by using a title on signs, mailboxes, address plates, stationary announcements, telephone listings, calling cards, or other instruments of professional identification or other. Unless all bodywork practitioners within the establishment possess individual permits to practice bodywork in the town of Wakefield, any person operating a bodywork establishment may not present their establishment as a permanent or licensed bodywork establishment, or to hold their establishment of the public as being permanent or licensed by using a title on signs, mailboxes, address plates, stationary announcements, telephone listings, calling cards, professional or advertisements of use. The use of aliases is prohibited if the therapist or establishment operator wishes to use a name other than that which appears on a permit. Both names must be used together in all advertisements and representations. So section 11, enforcement. This was not added but revised. These regulations may be enforced by the department, the Wakefield Police Department, the Wakefield Fire Department, or agencies supporting the town of Wakefield, except that only the department and or the Wakefield Board of Health may grant, deny, revoke, suspend, or modify permits or variances of these regulations. The grounds on which the department may deny, revoke, suspend, or modify a permit or certification issued pursuant to these regulations include but are not limited to, these are the sections that were added. Section A, refusal to permit an agent of the department, police, or other government official to inspect the facility. B, interference with the department, police, or other government official in the performance of their duty. C, a criminal conviction of the permit holder related to the operation of the establishment. D, failure of the permit holder to submit the appropriate documentation. E, failure to pay the required permit fees or assessed fines or penalties. F, the establishment's owner, operator, or employee's failure to comply with the regulations. G, committing a prohibited or criminal act. H, keeping or submitting any misleading or false record or documents related to the operation of the establishment or practicing bodywork. Number 2, otherwise operating a bodywork facility or practicing bodywork so as to cause threat to public health or safety shall cause suspension, modification, or revocation of license. Such action by the department may include ordering corrections of any violations of provisions of these regulations. We revised number 3, which said these regulations may be enforced through appropriate criminal or civil process, including but not limited to those specified Mass General Law, Chapter 40, Section 21B, in any court of competent jurisdiction. Added Section 4, all criminal acts or violations of Mass General Law will be enforced by the Wakefield Police Department. In addition, the Wakefield Police Department or Wakefield Public Health Department may issue fines per this ordinance on top of penalties assessed by the appropriate criminal court. Section 5 is revised. Any person aggrieved by an action of the department may request a hearing before the Board of Health as many requests of the department within 7 days of receipt of the order or notice. Upon receipt of such request, the department shall inform the petitioner thereof in writing the time and place of said hearing, which shall commence within a reasonable time. Okay. we adjusted the next section, number one, the Board of Health may suspend, revoke, or modify a professional practitioner or establishment permit for any violation of these rules and regulations or the performance of any legal act on the premises by serving an order in writing to the person or persons responsible for the violation. Number two is adjusted, the person to whom an order has been served may request a hearing before the Board of Health within 7 days after the order has been served. Upon receipt of such petition, the Board of Health shall set a time and place for such hearing and shall inform the petitioner thereof in writing. The hearing shall commence not later than 30 days after the day on which the order was served. The 30-day period may be extended if, in the opinion of the Board of Health, the petitioner has submitted a good and sufficient reason for such. And number three, at the hearing, the petitioner shall be allowed to be heard and to show why the order should be modified or withdrawn. After the hearing, the Board of Health shall sustain, modify, or withdraw the order and shall inform the petitioner in writing of this decision. And then we are also asking the board to add a new effective date. So in this effective date section, we're also looking to put in a transition period as well. So both an effective date and maybe like a 60-day, whatever, besides period of communicating with the businesses, all these new changes so that, you know, they have a chance to come to compliance before we start enforcing.
60 days.
It was suggestion of 60 days from the effective date. So if we make it
So,
effective.
yeah, so this is, we're not grandfathering anybody.
No.
Like. How long is it, how long is it for you taking these days?
How about that,
3 weeks.
Very fast.
like, couple days.
I'm on trying to do it during COVID time, it was a blast. It was a blast.
So the example would be, if the board decided to make it effective like April 1st, then you would potentially give it like 30 or 60-day, probably 60-day or 90-day implementation. So we would spend that time period going to each establishment,
Yep.
making sure that, you know, they know the rules, that they know where to go to fill out applications, that sort of thing.
How many licensees, how many permits do we have out now?
2.
Really, that's it?
That we know
2, but we have
officially.
10
We
potential.
give them
We
10
have up to
business days,
potentially 10.
put it in effect in 10 quote business days,
Well,
right?
hold on. Like, what, we're asking them to change their windows, take stuff off if it's on.
Well, if you put it in effect, but then you're going to give them a leeway, you're still gonna give them time after that before we would start to.
Well, like
fund, right?
Anthony's saying, we could say, for example, let's put this whole thing into effect April 1st.
Yeah.
And then give them 60 days
Yeah.
to sort it out, so
Yeah.
that would be what, June 1st?
June
That-
1st.
Yeah, so if you
that
put it in
everything-
effect
Yeah.
like in a couple of weeks, like the
Yeah.
middle of April, then you could give them 60 days afterwards too, or 30.
Well, we have, I mean, we,
Only have
so time is a little bit pressing because we still have these things kind of out in the ether with people wanting to re-permit, so we want to.
I would encourage the
Encourage
actual
the-
adoption date to be a little bit sooner, and then
And then
whatever,
a longer
a
sure,
longer extension.
extent, well, what,
coming into compliance.
yeah,
60 days seems.
I think
reasonable.
60 days
60,
is.
yeah.
So maybe like April 1st or something.
Yeah, that seems.
So that would give you till June 1st. We also need to plan for the logistics, so we, through a grant, we're able to bring in-person interpreters,
Okay.
in-person interpreters to come with us, so we would obviously schedule time with these folks and try and, you know, make it logistically make sense for us to go out. to
You're gonna be
the-
explaining to the.
Correct,
business,
yes. We'll be
like, at
explaining-
these places.
We'll be
Yeah, okay.
explaining.
So we have
the
two
interpreter.
businesses to talk to, right?
Well, we would, the
Oh,
ones
we got
we've
them.
discovered that may be providing services that we're not aware of, we would also go there and give them the benefit of having this presentation given to them. We would be posting this in the paper, we would be posting this widely that we're making these changes, trying to reach as many businesses as possible that may not.
June 1st would be a Saturday, so would you rather wait till Monday, June 3rd?
Well, so we could say that from April 1st to June 1st, we won't be enforcing on a Saturday, but that ends the 60 days, so then we could feasibly start enforcing June 3rd, Monday, but you wouldn't need to increase that window, we would just start Monday, basically. So-
No? Fine teamwork, that was exhaustive.
So April 1st, 60 days.
April 1st, 60 days.
Yeah.
Start getting ahead of ourselves, but those are the days that we're considering. Impressive work.
It was,
I can't imagine what we didn't take up, but it's always something.
it was a lot of work digging up. I mean, Dan, Deanna, Melissa, Aaron, they spent many hours digging up
Yeah.
every regulation across the state of Massachusetts to find appropriate measures and.
Yeah.
Yeah.
You know. Does anyone, so is the board prepared to accept the changes to the policy?
I could make a motion to accept the updated rules and regulations for body work with the discussed and amended changes, including going into effect April 1st with a 60-day compliance period window, yeah.
Second,
I'll second the motion.
all in favor?
Monahan, aye.
So were I.
Gordon, aye. Well done. Whew. We need glasses.
All right.
Okay. All right. Actually, Candace did vote to close the hearing. Should we officially close the hearing? Even though we just voted?
Make a motion to close the public hearing on Wakefield body work regulation changes.
I'll second that.
All in favor?
Monahan, aye.
Silver. Okay. Moving on. Discussion of nicotine-free generation. So this is discussion, so I just want to review the timeline. Maureen might interject here. I imagine I'm going to hear about it. We brought this to a public hearing last fall. We have not deliberated amongst each other. We haven't talked to each other about what we think about this. We have just been on a listening tour for months and months. In the meanwhile, I'm imagining that Maureen, you'll update us, or one of you will update us on the
actually,
progress of the law.
So we actually have a
Yeah.
guest,
Norton's been here?
Mark Gottlieb was one of the attorneys, in the Brookline case. He's best able to explain exactly what was decided.
Okay.
And more.
So I invite Mr. Gottlieb to fill us in on what we haven't known since these months of listening. I didn't read the yesterday's report.
You didn't?
I did, I'm sorry, I took your word for it.
Well, just thank you for listening to my update. I no advocacy here about the measure at all. I just wanted to just update you as to what happened with the Brookline bylaw that was challenged by a number of tobacco permit holders in the town of Brookline. My organization, the Public Health Advocacy Institute at Northeastern University School of Law, had offered to represent Brookline pro bono, or any town or city in Massachusetts that adopted this policy several years ago. And Brookline was the first to pass this into an amended bylaw. And predictably, there was a legal challenge, and we represented the town pro bono. And in 2022, the Norfolk County Superior Court granted our motion to dismiss the lawsuit that was brought by the retailers.
2022?
Yes.
Okay.
Yes, in late 2022, and the retailers had filed an appeal with the appeals court. The appeal was taken what's called sua sponte on its own by the Supreme Judicial Court to ultimately resolve the legal issues that were involved in the matter, and oral arguments were heard on November 6th of 2023 at the SJC, and in March, a unanimous decision was rendered by the court that affirmed the lower court's ruling dismissing the the complaint on two bases. One was on the theory that the Brookline bylaw was in conflict or preempted by the state law that's establishing the minimum tobacco sales age at the age of 21. The lower court and the SJC agreed that there was no conflict there and was not preempted. That it complemented the legislative purpose of the Tobacco 21 state law. The second legal theory that the tobacco retailers had brought in their lawsuit was that there was a violation of the equal protection provisions of the Massachusetts Constitution, that two classes of individuals were established by this law. The legal standard for something like this, unless there's a fundamental right or a suspect class involved, is a rational basis review. Does the government's action, is it rationally related to a legitimate government purpose? If it is, then it survives any sort of equal protection challenge. And the lower court and the SJC agreed, the SJC unanimously agreed that there was no equal protection problem. So this result should resolve any legal challenges to the tobacco-free generation policy, where other cities or towns in Massachusetts to adopt it. My organization's offer to assist or to defend any legal challenges still stands. And I just wanted to make that clear, in case there is another challenge, which I think would be highly unlikely. Anyway, that concludes my sort of summary of where we're at now.
Mr. Gottlieb covered a lot of it, but just to highlight a couple of key points from the SJC decision. It was a long document, but they noted that state laws and local ordinances and bylaws can and often do exist side by side. They said this is particularly true of local ordinances and bylaws regulating public health. Among these local powers, no one is more important than that for the preservation of the public health. And they say that the great object of the city is to preserve the health of the inhabitants. They also noted that the market base for tobacco products in the town as the market base for tobacco products in the town shrinks, the economic incentives to sell the products in the town reduce. And that they found that businesses seeking to make a profit selling tobacco products face powerful economic incentives to reach younger customers.
Is that a few?
That's it.
Okay, I just had a couple of highlights that I wanted to read from the document, because I thought these were particularly compelling, and recognizing the folks at this table, I would think of special interest to you. You have a long history in public health. One is local communities have a lengthy history of regulating tobacco products to curb the well-known adverse health effects of tobacco use. So that's one report. And is tobacco use, particularly among children and adolescents, poses perhaps the single most significant threat to public health in the United States. And then threaded throughout this is really applauding public health's work and leadership role in public health in the Commonwealth of Massachusetts. And so I just wanted to share that with you, because you've done this for so long in multiple roles.
And the final update would be that last night, the Solon Board of Health became the first Board of Health to adopt nicotine-free generation as presented.
Any discussion?
No, I think this sounds like the way we should be heading. I felt that way from the get-go. But I think this is a simple policy, which makes it easier to understand for me, for everyone. and easier to enforce. I think the idea that we could possibly kind of grow a generation of young people that no longer have interest in nicotine and have this opportunity to kind of do that feels like what we as a health department and the board should be focusing on. Yeah, I think this makes sense to me.
My thoughts?
I've got prepared statements.
Wow, that's not fair, the chair always gets that good idea. I think that being involved in public health, being an ex-smoker, having family members and taking care of people for the last 40-something years in nursing, with lung cancer and lung-related issues, I see that smoking has always sometimes been, I call it the root of all evil. And if we couldn't have had it or had that opportunity to get it, maybe we wouldn't have seen it. I have been involved in being one of the communities with second or third to prohibit the sale of tobacco in medical facilities. Took a lot of heat for that, a lot of heat, a lot of things, but I saw it work. And I think that this is something that I see that it's part of our job and our wish to make a healthier community. And why not start with that next generation and try to lead them by example and to give them something to look forward. I say to look forward to, that they don't, it's not there. I know that everybody says it, I took a lot of heat from a lot of people, let me tell you, the last couple of months. And a lot of opinions of how you can go. I know you can go anywhere else and get it, but to have it right here in your own community and to possibly see that generation. I don't know, I probably won't be around to see that generation. I hope I am to see it, but I think in putting it in effect is something you should be proud of, that we're willing to take that step to go to help to protect. And you're not only protecting that youth, you are kind of protecting the other people in your community of, secondhand smoke. And if you read the data, a lot of data on lung cancer, and I've been involved in lung cancer. The data on that is very, very strong.
Okay. You guys aren't gonna like this.
It's okay.
No, I think it's a worthy policy. I have a couple of thoughts. One is taking a nod from Brookline. This was a town meeting vote for that. I worry, I know we can, this is not, I have no doubt that we can or cannot do this. I am in I'm thinking of the bigger world. And I'm thinking about political capital, quite frankly. So I'm just pulling from the email that I sent to Anthony this summer, just about thoughts around this, because I feel that I am the queen in some regards of unintended consequences. So one of my thoughts is that we have just gone through a mighty bruising amongst healthcare providers and a mighty bruising in science and public health. The public sentiment is not as with us as it used to be, and I just want to be aware of whether we're in a different place. We have, like I've never seen, we've grown up with these changes. I worked in a break room in a hospital at Mass General where nurses were allowed to smoke indoors. Like, we have come so far. We have done, I just realized that the last vape shop standing on Albion is gone. And so, we have been hitting this from, picking at this from every sort of thing. I've got to tell you, I have an unintended consequences worry. And my worry has nothing to do with being pro-tobacco. It has to do with human behavior and what we've seen and how we've had outlandish human behavior. And I really do worry that there will be an assault or a violent interaction with a provider if they cross state lines or cross a region. And because of that worry, I would like buy-in from the town. I'm not sure that I'm prepared to vote, and if the board wishes to vote on this, I'm not sure how to vote. So I just, public health workers have undertaken moral injury. This has nothing to do with whether we can do this. This has to do with me watching the bruising that people have taken on the healthcare and public health sector. And can we get to this goal any other way? Because I worry about the public perception of overreach. This is a political worry that I have. Political meaning, this is a behavioral worry that I have. In every other, in every other instance, it's about group versus individual. You can't smoke in my restaurant because you're polluting my air. You can't smoke in a building because you're polluting my air. I know, and Maureen has said, there is no inalienable right to smoke a toxin. But the very next thing on our agenda is opening a shop where people might smoke a toxin, I think optics are important. I think buy-in is important. I would prefer that this come to a town meeting vote because I feel like it's the voice of the majority. We are, however, elected to really cover, what is best for public health, and the town elected us and trusts us to do so. So it is definitely our right. I'm just sharing my concerns. It could be, it could be not, it could be a non-issue.
No,
I
think your concerns
You know,
are fair.
I'm a little
It's
worried about this one.
fair, that's reasonable. I don't know for me that I feel like the concern about public outcry is enough that I would change my feeling about doing it here tonight. I do feel like we are the right group. It would be great to have town buy-in also, like if we could have our cake and eat it too. I guess I worry about delaying. I feel like we're in a good place right now with Brookline and the judgment, good precedent with Stoneham next door.
I would also warn against picking and choosing, because the Board of Health has enforced and has passed many tobacco regulations. Picking and choosing at a time when to pass and when not to pass a regulation becomes slightly arbitrary.
I think that, I understand, and I've talked to myself about that. But I think that if we look at our history, as you say, and we look and ask Maureen, we have in the last 10 years come so forward with tobacco and controlling it and trying, and it's,
So what
no
do we
matter
think?
what we do, it's going to be criticized.
Well,
whether we did or we
no,
didn't.
but, and all along, I support the effort, I support the wish to have a tobacco, nicotine-free generation. I mean, I pound my patients with this, poor things, we go over it. I have patients who said, I wish I had done the law, I wouldn't be in the pickle that I'm in. I have to say, and some of you are already at the, I thank you, because I think I recognize your faces from the first meeting. I think there were no ludicrous arguments. We've been in meetings where people have made the point for me. And I appreciate the very honest, that this is not a health product that you're selling. I understand, we work in a world where we have medication assisted treatment. We are in harm reduction. We're always sort of making a deal. So I just want, this is just the opportunity for me to throw that on the table. Is everything going to be an internet sale? Is everything going to be an out of region sale? There is an element of this that works. I have patients who just don't smoke enough because they're not driving to New Hampshire and they're not paying the taxes that we have here. So these things do work. I have just been struggling whether or not this is the policy that's going to work. I suppose if you know, there's always the opportunity in the future to change a policy, tweak a policy. I'm kind of talking to myself here, so bear with me. You know, so it's not about a lawsuit. It's much more about buy-in. If it's and I get it, this is an opportunity, and sometimes you just gotta thread this needle. Same thing happened with the ACA, right? I was like, geez, how did we get that through so fast? We had the political capital at the time, so we have the availability to do it. I'm gonna give myself a moment if you guys wanna come to a vote. This is where I go, I just want to record that I have concerns about unintended consequences, so the goal is worthy. It will be very interesting to then really track what's going on with out of region access. We don't want a prohibition era undermarket happening. So that, no one's put that on the table, no one said it, so I said it. I'm all done.
I understand what you're saying, but even going back to when we had to make the decision on selling tobacco products in medical facilities, the rebound that we got, I heard it from the pharmaceuticals and the drug stores that were in business, and also from a quote big box store that sold it, and what were they going to do, and how were they going to. And at first, there was a lot of heat from them, but when they actually sat down and listened to us, they went along with it, and they still do. And even it helped to control, it was another state that had the big box company go after them first, and they actually came out to us and spoke. And this big box company actually changed their policy on how they sold the product, and they felt much safer even doing that and being better. So I see, I think, I understand, because you're good at our mental health and you try to think of us in that. And I think a lot is going on in the world where the mental health situations are every day there's something new, and that's all somebody's got to hear about, and we go off on tangents about it, and it affects people. But I think with this is, when you look at it, we're looking at a generation. So you're looking that this will not really see anything when you put it into effect. It's going to be another 15, maybe 15, 18 years before you really and truly see this. In the next 15 to 18 years, tobacco may be gone. Who knows? And if it is, that's great, because we don't have to worry about it. We'll be the nice people in the history book if they still have them. But I don't know. I think that, and it's hard being, there's only it's just now Brookline and Stoneham. There's no one else, but there are a lot on the table that are having the hearings, and sometimes it's hard being in the first top 10.
But we've been here before.
But yeah, and I've been there before.
Why
so
can't we be behind? Like, why can't we just watch these
Well, you know how we are. We just have a good reputation, I guess. I don't know.
Do
what
we
it is,
always
but-
have to be at that?
I think it's our responsibility, you know, I mean, we have an opportunity to make some good change here and to be leaders. And like we mentioned before, we are elected by the town to represent them, and that's what we should do.
It's something that we have to, and you're not gonna see this effect. It's gonna be a long, long time before we see it. And who knows, like I say, everything can be changed. If there's something that comes about and some new study comes out and some new data tells us that you don't have to worry about this. But I think if you read the data and you see the younger people between the vaping, and I actually was out of state this past few weeks, and I actually walked into a place that they allowed smoking, and I almost went like this, and I'm gasping, and I'm like, oh my God, they still allow you to smoke here? And they go, oh yeah, you can do that. And it was very hard to take, but I don't know, I feel we can vote. I feel bad that we put you in this.
No,
predicament.
that's the privilege of being here. But so what I would suggest is that I make a motion to push this at the town meeting. You don't have to
Yes.
second the motion,
Yeah.
right?
How do you feel about town meeting going to the majority? Do you feel that they understand it?
I'm not convinced that I do. I haven't had a lot of time to think about it.
Nope,
Yeah.
that's fine.
I kind of feel like it's on us to do it. I feel like this is our purview. I feel, You know, we are not only the Board of Health, but we're also 3 healthcare providers. I feel like we are in a great place to make this decision. We've listened. Town meeting won't have as much opportunity, though they may have opportunity from anybody that wants to come and present. Is it gonna get lost in the scrum of all the other stuff on town meeting?
I don't know, Brookline did it.
I would also just clarify, for Brookline, historically, they passed their tobacco regulations through town meeting.
So that's
which is
their,
diff- That's their process, which
That's
is
their
why
process,
that's
okay.
what's
and this has been
happening.
our
This is-
process.
right.
Mm.
So I think I would prefer to do it with us.
That's, you know, that's good input, because I just, this is my rationale. You have bigger buy-in, they can't sit there and say, you know,
I think no matter what, there's
those
gonna be
liberal
pushback.
public health people,
Oh,
but,
yeah, yeah.
And I
but
feel
there'll
like
be
on the
pushback
whole, you're gonna probably have more
and spare town meeting, you know.
positive views on this than negative, but yeah, you're gonna have negative, and there's gonna be negative views that are loud.
There is, there's been a lot, I mean, and I think that the comments that we've received and the letters, I've read them all, they've been good. Whether they've been
Thoughtful.
for or against, been very, yeah, I've read them and said, oh, okay, I understand where you're coming from and everything. They were very, very interesting to read, in my opinion, but
And it's not lost on me that for folks, especially folks in this room, that this is how they support their families and that this is their job. And I understand that that is really hard. But I think it doesn't take away from my feeling that this is an important thing. And more discussion.
all right, I think I'm okay. Yeah, this is okay.
I'm good.
I'm good.
So I won't.
We need to have a discussion about when this would go.
So
Yeah.
we can talk about effective date. Effective date proposed right now would be January 1st, 25,
Okay.
with a birth date restriction of January 1st, 2004.
Would you say that date again, be with the
So
restriction?
effective date is January 1st, 2025, making the birth date restriction January 1st, 2004.
2004.
So anybody born after January 1st, 2004 would not be able to purchase nicotine products within the town. That's what it's proposed.
That's proposed.
So we're giving business owners, what are we in March?
We're in March, right?
A lot, so whole.
Yeah, so I actually, it gives me a little treat. Okay, you ready for your motion?
Sure, I make a motion to accept the nicotine-free generation proposal.
Do we have it as a policy?
Policy?
It's well, I can read you the language. It's the proposed language is prohibition of sales. No person, firm, corporation, establishment, or agency shall sell tobacco or e-cigarette products to anyone born on or after January 1st, 2004. Any person, firm, corporation, establishment, or agency who or which shall violate any provisions of regulation and upon written notification shall be fined and suspended according to the schedule set forth under the regulation of the Wakefield Board of Health restricting the sale of tobacco products.
That.
So we're
Got that
But
written.
there was some big, oh my God, what was it? They actually gave them a whole year before they put it into.
Well, we could decide
Like an effective date.
Right.
Yeah, I'm thinking more leaning towards January 1st, 2026. Because
So
I
the-
just saw a state thing recently and that's what they actually gave everybody was a whole year.
So the effective date discussion happens generally regionally, so this policy again is acknowledged to be more successful as a region. Other places that are going to adopt a 2025 start, so
Maybe they
having,
are, that's
having
a
being.
problem though.
What did
People
Stoneham,
like me.
did Stoneham?
Stoneham adopted January 1st, 2025, making this possibly a more consistent.
And Melrose is,
The language they're considering right now is an effective date of January 1st, 2025. And the same would be said for Malden by a public hearing.
They're all part of that.
and 2025 is what they're considering.
Correct.
And how soon will the other communities be voting?
So we have several communities lined up.
Yeah, so Winchester has a public hearing on April 25th and Reading has a public hearing on May 7th. The Medford Health Director has been away, and I haven't had a chance to catch up with her, but I had presented to that board, and they were waiting for the SJC decision, like many boards were. That has happened, and I anticipate that Medford will probably do a hearing as soon as they are able to.
Do you think they're all gonna go close to the January 25th date or?
You know, yeah, hard to say, but if it, let's say they had a public hearing in April, then they could vote in May, then it would be 6-7 months before to do retailer education, community education.
So what we're 8 months.
8 months, yeah.
I'm sorry, I'm
Go
going
first.
so political on this, I can't even help myself reading too much.
The first of the year is always, everybody always makes New Year's resolutions, right?
Yeah.
I mean, I think it's consistent with the birth date too.
Yeah,
That-
yeah, it is,
that-
it is,
it's
that's
easy,
nice,
yeah.
it's
Yeah.
good math, I agree.
So they're one
I
in
mean-
2004, what are they now?
2005.
2005. So,
These poor retailers, but it is true, it's easy. So I guess that part doesn't matter, there's no math involved, that's the whole point.
You okay with that date then, January 1st, 2025?
I am comfortable with that.
Yeah, I'm close to that now.
So,
The motion might
motion
be
is
to
to-
adopt this as part of the existing tobacco regulations, adopts nicotine regeneration.
okay, so I make a motion to adopt nicotine regeneration as part of our Wakefield tobacco and nicotine regulations. With a start date of January 1st, 2025.
Okay, I will second the motion.
All in favor?
So right.
Or will I? Oh, God, talk about marijuana.
Anything else on the agenda?
Keith, thank you for participating.
Did we have that discussion?
No, we had it in public meeting, I got updated. All right.
Thank you for joining us.
Thank you. Thank you very much for submitting all your letters.
Appreciate it. Okey-dokey. So, I just got an email today from Erin, no, what's her name, from planning?
Eric Okinda?
Yes.
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 Someone told me something big and they said it's awesome, but I don't know what that is, okay,
So, the attachments that, from what I understand from Eric Okinda, were the amendment of zoning ordinance, chapter 190, that it's the proposed zoning ordinance brought before the planning board.
so let me just tell you why I'm interested, well, why I think this should be on the board, and Catherine actually has helped me with this because this is what I've been talking about in regards to the town we just have to get better, the boards have to get better and kind of vetting what other board might have something to say. So, just to review town bylaws, any citizen petition for anything can be brought, can be written the way it needs to be written, and with not that many signatures, can become an item which should be voted on. So there is a citizen's petition which got forwarded to you. I have to say Julie Scott is different individuals in town have ideas, and it's great that they feel, that they then bring it to our attention. What's interesting about this is years ago, you need to know in the history, when we were deep in the DFC grant and Massachusetts was legalizing marijuana,
I don't see her.
okay.
But you're referring to the 2013 registered marijuana dispensary.
Yeah, and then Wakefield took it upon themselves to have a moratorium that we don't, we didn't want any shops in town.
2017 to 2018.
Yep. Yes, so thank you. Timelines are so important, been a blur. So at that time, it was very important because we were under a DFC grant that we did not necessarily take a position, that we only educated. Now we don't have that DFC grant. So I don't know if the board can actually take a position. I can get up at town meeting because I'll no longer be on the board. Julie's, I'm sure Julie will be speaking, pretty extensively. Do we at least want to speak from the board? So what happens in town meeting is, this is up to planning board, and planning board says, we do or do not recommend this. The last meeting, they were kind of like, I don't love this whole thing. The idea is it's in this very small parcel in Audubon. If it's gonna be anywhere in town, quite frankly, that's the place for it to be. But I feel that the health, that our resources within our department should at least be well versed on what does it mean? Because the people who are representing it is like, well, maybe it will be money back to the town. And what we're hearing is that's not really happening. I think Julie's point that the Cannabis Commission is not proven itself yet to be that. Like we have the Alcohol Commission, we have local authority on tobacco, we have mass regs, but cannabis is a mess right now. And on just the very business model, I think the town meeting will have some opinion. But we are working really hard. We just did this, and it was interesting because in that public hearing, we were like, why don't you guys do anything about marijuana? I'm like, oh, we're trying, you can only do one policy at a time, right? So I don't know what you think of. I will have an update our next meeting, but I don't know if and I don't even know if it's appropriate. I would have to speak with Steve and then I can call you back as a private citizen, but whether it's even appropriate that Board of Health stands up at a town meeting and says, listen, we're really working hard, in this town, just to remind you. And I think that's a reasonable thing to do. It would be unprecedented if Board of Health came up and, said they had favorable action or not. It's not our thing, it's planning, but it has to do with us. And we have to be aware as to whether or not we're ever gonna have a local cannabis, a local dispensary, but a local rule like we do with tobacco, right? So, it's a little weird.
So,
What do you think?
just a
And
couple,
Melrose has one.
correct.
It's not awful, I could, again, I'm making up stuff up to be
Oh,
upset about, but I'm just,
Well, I can,
all the unintended consequences here.
yes, I can speak to some of the Melrose experience. So actually Maureen was on the marijuana advisory board a few years ago, right?
Yeah.
What did you advise
A
them?
few years ago. So Garden Remedies is in Melrose. It's on the
Yeah.
border of Melrose and Malden. We had a community impact agreement with Garden Remedies for, say, 5-6 years,
Yeah.
almost 6 years. That impact fee is no longer. So across the state, there's a movement. Many cities and towns have been negotiating with the dispensaries. Many of them have either negotiated a clawback or a standstill, as Melrose has done. So Melrose is no longer taking in community impact fees from the dispensaries. So that's some of the Melrose experience. It's remote in the sense as Melrose can be.
And this would be as well.
Yes, a couple of things I would want to bring up to the board is the location suggested by Audubon Road. And again, my position on this is not necessarily, I'm not looking for an all-out ban, that's not my position, but.
Well, if they're asking for us to reverse our moratorium, we have, the current bylaw is Wakefield has a moratorium on dispensaries, period.
Right, so the way I read the moratorium, it looks like moratorium ended in 2018.
Oh, sure.
But only on a decision, right? So you can make a decision now
Right.
after the moratorium, but A couple of things that might want to be brought up is, if we're gonna be talking about health equity, as
Yeah.
part of this conversation, the location is
Yeah,
by,
right across from
it's
a
by
low
95.
income.
It's very close to Colonial Point, which
Yeah.
is a highly dense area of low
I like
income
that plan.
families. Something that we want to consider.
Yep, yeah, no, they said that, it's just far enough away from
Yes.
Odyssey.
And unintended consequence, like you said, having it near, economic disadvantaged area may not be something that we're looking to. Another thing that I would want to bring up is that there are other towns some have allowed this, some don't. A lot of them are zoning only. An example of a town that adopted recreational use but also has Board of Health regulation is town of Belmont, as an example. So they have a whole regulation from the Board of Health regarding recreational use. So there is.
So what is Belmont doing then?
Sorry?
So I'm sorry, you just said, I just lost you for a second.
Oh, so the Board of Health in Belmont has passed additional regulation on top of their own zoning.
Okay,
So,
yeah,
when you said
Sorry,
if the
guys.
Board of Health should be involved, there's precedence of that.
so local. Okay, yeah, so I just wanted, you to be aware that this is up, and it might be your next discussion. We have not had the time to address it in Wake Up. But it snuck up on us, and Wake Up's been doing some incredible work. One is cool. But so what town meeting is 29th? Sounds like it's gonna be a long one.
The 20th, 30th, 31st.
Yeah.
Well, no, it's a Monday, it's always Monday, Thursday,
Isn't it
Monday,
on
Thursday.
Saturday this year again, town meeting?
They're starting on a Monday night,
Starts on Monday night,
so
so-
I don't, they generally, years ago, it was always Monday, Thursday, continuing, for God help us if it goes before, that's the record, I can't imagine. And I don't know how much interest the town has in this. I have no idea what the read is. Just so you know, you'll see, there's a Laurel, I said, I am not representing the Board of Health, I am just on the Board of Health, I just, this is at the planning board, but of course, it was voted for. But who cares? So I didn't try to represent you. And I just was, I just was like, listen, this will impact our work. We are interested parties. And if all you just want to be is an interested party, or we have the opportunity to have a statement, and we can certainly see where this goes. I think our next meeting, April 17th.
Yes. Which is after the meeting.
No, April 17th is before town meeting.
Yep, the town meeting is the 29th.
Yeah, so, to be continued, we'll have more information.
Yeah, it'll be good.
And what's nice about this is because Catherine happened to be going to a municipal meeting, I was like, see what other people are doing. Who have dispensaries, so she's got the ear of somebody, and then even, talking to someone on the planning board saying, hey, just, don't forget us. I mean, I've been spending all year with town council going, will you stop making it about us without us? And we're getting there. But it is an upward battle. And so if we're not paying attention to local news and what other boards are doing, we might miss an opportunity to weigh in. I rest the floor.
So noted.
That's all. So more to follow in April. Or not.
I think it's just gonna be very interesting, because that was one thing when I looked at the agenda tonight, I go, here we are, I'm gonna do something here. and
Full
then
circle.
it's coming.
I know, well, that's exactly,
What do we do here? But what is our role in that? As part of a planning, I mean, they can put them out there, I don't know if you remember, a few years ago, we talked about, tattoo parlors, and this Ruth was in, and I get done when we were talking about regulations, and, she says, well, the only place they can go is up there on Audubon Road, so it's so desolate, they're not gonna go out there, but look at the development up there, I mean, Moby Dick might still be there, and he hasn't come up yet, but, there's so many businesses out there, you got hotels, it's kind of a big, very busy area. So
We'll
it's
see.
adjacent, so
It's an
who
odd-
knows, see what.
It's an odd world.
It's also really close to Communitas.
Yes, yes.
Oh,
And
that's
yes. Yes, thank you for reminding me. I noticed that the other day because my tax guy is on that same road. And I was like, gosh, darn it, Communitas is right there.
Well, Communitas, Colonial Point, it's. you know,
Hotel is there on the corner
hotel,
coming
it's
down. to
Close
Pepsi.
to Lynn, close to Market Street, I know it's not
Yeah.
Wakefield, but it's close to.
No, yeah, no,
Market
it's
Street.
very close to
It's convenient to
Market
Market
Street,
Street. I had
And
the
there's
same
also,
thought.
isn't there's a police training,
State
where you
police
take
training.
state police training.
Field
Yeah.
volunteer.
So taking a nod from my business school spouse, he said, watch out for the word, open the door. And so open the door, you get one, you have the model, and then some other ones will come in. And so it was very interesting because the person presenting was saying, and this could be, an open the door opportunity. I was like, that's exactly what I'm afraid of. So I'm just in the mood to be contentious.
Wow, you're spending your last
I
night
know.
really
Killing me.
singing it to us, right?
Killing me.
I would also just mention, I looked through it, it's a long presentation. I don't know if there's a cap discussed at all, a number of permits cap
On the dispensary?
in the planning, yeah, I don't, did
I
you?
mean, it's an overlay area, it can only happen at that address, is what's on the thing, so you
Well,
can't have
right.
too many in that area.
Right, but
But yeah,
I'm just
good
saying, I'm
point.
thinking like overall, like if,
Or if, with open the door, is there gonna be a
yeah,
cap?
so I wonder
Yeah.
if that's something that we should also discuss.
Okay. Leave you discuss it.
I've given you all this material, you should be using it.
Have we said enough about that?
I think we have.
Anthony, do you have a health director's report?
I
Oh my
do.
God, there was a fire. And this is
interesting.
bad, medicine store, the restaurant, this is a big
Yes.
deal.
Actually, the medicine store is, I just learned today, the only one after Smith's Drug closed, it is the only local pharmacy.
I know, and he is
Yes.
incredible.
Yes.
Oh, yeah.
He's incredible.
Yep.
I'm gonna tell you, as a prescriber,
Yeah.
he's a gem.
He was very good, he worked with us very closely, the Massachusetts Board of Pharmacy, also very diligent, they were there before we were.
Good, okay.
So I just wanted to give a quick update, so there's fire at 387 Lowell Street, that was actually the exotic pet store in that block.
The pets died?
I heard maybe a few, I'm not sure.
And is it Paws over there too?
Pause is at the very end, yes,
Yeah.
it's in the same
Yeah.
street, yep.
Yeah.
So fire dispatch called at 9:20, I arrived around 9:40. I was able to walk through most of the food retail businesses, that's J Gourmet, Dino's and Olive that were there. Dino's took the brunt of it. They will be down for at least a month probably. They're doing reconstruction, water damage, smoke. So we were able to communicate with all the owners of the businesses that night. And then I came back out with Aaron the next morning to talk with them about their options, what needs to be done. Clean Joe, which was one of the companies that was already brought out, to start doing restoration, was already out there.
Was anyone hurt?
No one was hurt in this fire.
Fire
Yes,
department too?
the fire department, I think it was a 2-alarm fire at the end, there, 2-alarm fire. I'll skip down, Chief Sullivan and Deputy Purcell were amazing, they were great, they interfaced with everybody on the scene to make sure that we're all in the loop. And they did a great follow-up, Deputy Purcell was in every single business talking with the owners, making sure they knew what to do, what to do next. So based on the presence of soot and the smoke condition, a lot of food products and single-use items had to go. And then there also a lot of deep cleaning had to happen for all these businesses. The pharmacy is not something that we regulate, as you know, but we consulted with the pharmacy board. We ended up working out an agreement with them where they would discard of anything with cardboard material. And then any of their hard plastic containers, they would bring in a professional cleaning company to scrub down and make sure that they were cleaned properly. Their facility would also be cleaned properly. The pharmacy board was said that they were comfortable with that. I guess this is their first time dealing with a fire that didn't include a total loss. So this is learning, kind of a learning experience for all.
Right.
But
So how long will it take for them to open? They're the most pressing.
for
They do
the
it for us,
pharmacy is, the cleaning will take some time because there's a lot of hard plastic bottles.
Yeah.
I mean, it's like individually
So every little
washing.
bottle has to be.
Oh.
Anything that's not damaged and thrown away, needs to be cleaned, so it could be some time, but it's
I
not
think
as
I'm
long.
rewriting prescriptions to Walgreens.
Yes, but the owner was very compliant, very willing.
Oh,
to-
he's unbelievable, I am telling you. It's a gem, because, just like, people really miss Smith. Smith, the people were not, someone was just telling me that they weren't warned that that pharmacy was closing, and I'm sure that was part of their closing deal. So all of a sudden, their stuff was handed over to a mail order, and I haven't, well,
Yes.
it hasn't been that thing, but the medicine store, he'll do IM injections of like monthly, like constant stuff, again, to this
Like classic
popul,
pharmacy care.
to this,
Yeah.
well, to this population that is underserved, and it's
Yeah.
really tricky, right?
Compounded.
Yeah, well, and just, he'll do, monthly, shots for those who require them. It is tricky to get that service, so.
Mhm.
So thankful.
So they should be up and running as soon as possible. Dinos will be down for a little bit. Jade Gourmet is ready to go. Malazar's fine.
Now look at this, you thought we were gonna pass the body work establishment tonight.
Yeah.
It's good to be.
I had no
I'm
insight.
sorry, you printed this before the meeting.
I am all knowing. Body work establishments. So in preparation for a potential vote tonight, Elaine, Cindy, and I drove around Wakefield to identify the existing permit holders and unpermitted
Oh, wait, what?
establishments.
It was a beautiful day.
Oh,
It was gorgeous. I loved it. A lot of steps in.
Yes.
It was fun. It was like being back to work.
Yes. We found body work establishment places. We also found non-body work establishment places, which was very interesting. There's a beautiful building off Albion Street
Oh,
that's
yeah.
an engineering firm. That used to have a body work place there. It's beautiful. But we took a little field trip and we identified potentially up to 10 businesses that are either advertising. It's ambiguous. Some of them are like the name, it's in the name, but not in the services. So
And
that's
you
why
only
we
have
said-
two?
We only have 2 permitted right now.
Oh, boy.
Okay,
So we have a lot of work to do.
okay.
These places are part of our plan to communicate within 60 days, which is second the board. It will be in those places with interpreter as needed to make sure that they get the information. It was a beautiful day.
It was gorgeous, yeah. I get to sit in front
A
seat
beautiful
with
day for the
Anthony.
neighborhood.
Whoa.
What is that kind of
Big
thing?
deal.
I offered it to Cindy, but she said, no, I'll do the back seat.
Yeah.
She was in, and I was the go-to sometimes to go to the
Roll
door.
out a
'cause nobody
window, just
knows
take a
me.
ride.
Nobody
Yes.
knows me. Bring 'em
Oh,
back, knocking the door. Nobody knows me, so.
We documented Elaine's adventures in Wakefield.
We'll be on video, we'll be on YouTube in a couple of months.
WCAT, film
Yeah.
WCAT.
It was interesting, but it was good, because I've been there, done that, and doing that, but doing it right here, when you realize, and how many letters we've gotten from residents, about, oh, this here and there, and one was like, and then riding around when we did, oh my God, it was eye-opening, eye-opening.
Well, I think the regulation change and no shielding windows is.
That'll be a
one.
huge change.
Just make town look better.
Yeah.
So, it's an interesting. Okay, anything else?
That is all I
Sitting
have.
around.
Does the public health nurse have anything to say?
Sandy did the report and I don't have with.
I have the report if you would like to.
Sandy was
As part-
on
as part of
earlier,
our
I
health
saw her
She was
quickly.
on.
Did we get the nursing report?
We did, I can present that as well.
Yeah,
and
just
Thank
go
you
ahead
for
and present
reminding me.
that then.
That was my
I
oversight.
always like to make sure they're included.
Yes.
Thank you, Lynn.
We are getting there. Anthony
Yeah.
wrote his report. We are there. Like, it took a little while.
Directors are a little difficult to.
Yeah. All
Oh,
right.
you don't say, okay. So, public health nursing, oh, give me 1 second, this is the report.
What I saw for the cases was for the year.
We got our warning for measles. and everyone's traveling. Unbelievable.
Yeah. No outbreak in Mass yet, though. Yeah.
Or it was in Florida, parts of Florida, using it this
Yes.
week, it was, yeah, really big time. And trying to convince family members with young children, you're gonna be traveling internationally, I don't care where you're going, you better go and get that MMR early before you go. I got a couple of little books, but it's all right.
Okay, so
Any change?
We have guidelines of how young can we give them, how
Yeah,
much further,
yeah.
if we need to. Yeah, I don't know them offhand, but I know.
So the March report, there are now 16 flu clinics to date this flu season. 699 flu vaccinations were administered. We worked with communications department, Jen McDonald, big shout out to her.
Love her.
Yeah,
Yeah.
she's fantastic. DPW to advertise clinic availability. They worked with news outlets and social media, sidewalk, menu boards, electronic signage, just any way to engage the public to know that we have it. 2 additional flu clinic vaccination clinic sites were added. That would be the library, very popular site. And the evening clinic, the English language learner event at the Galvin Middle School. Where we also had community.
It was good, but we only did like less than 10.
Yeah.
Yeah, so what are our numbers over the years, just going down, down, down?
Yes, but the number of people who got COVID and flu vaccines this year nationally went way down.
People just getting them more other places? Or is that
They're
everywhere?
definitely getting them more other places, but people just aren't
I'm
getting
getting
them.
vaccinated.
I think we
It
might
was a
have
tough
mentioned
flu
it.
season.
We mentioned it last time too. I think.
39% or something, it's just very low.
I got it
It's,
myself.
it's hard to compete with pharmacies that have $5 or $25 vouchers.
No, but you're talking, well, yes,
Yeah.
but you're talking about the overall
Right, national.
immunization.
Yes, I'm talking
Period,
national.
all comers, like our,
Yes.
United States is not immunized,
Right.
immunizing is not in fashion. So we gotta, well, I mean, you have it bad enough. My brother almost became unconscious with our baby,
Yes.
Ron.
I think we're gonna have to cut back on our vaccine next year
Yeah,
because we're,
what's the point? Yeah.
We are ordering less.
sad.
And we aren't the only community, there's
everybody.
all our public health nurses at our local regional meetings are telling us the same thing, they're having it. And the state supply isn't as high anymore, you're not getting what you used to get.
So maybe that's okay too.
We were only offered 10 vaccines.
Yeah.
If we were gonna participate in the state program.
Wow.
Yeah,
It was more
some
people
would
than us.
get three, like 400,
Yeah, for
500
all
a
of
year,
the
got
headaches, so I guess you'll hear what else we do. What were you guys doing at the Galvin on voting day? You and Sandy were in there, in the cafeteria.
I don't remember.
A bunch of people, was it a school nurse, like, was it?
On voting day. We were doing our CPR research with the Galvin, with all the Wakefield nurses.
Hey,
All
any
right.
other business not reasonably anticipated?
Or
since
hold
it
on,
was
do you have any more
voting? Oh,
nursing
anything
stuff?
else?
We're only like a quarter way through.
Oh, I'm sorry, I thought you finished. I thought you
Yeah.
had it. Oh,
We've done a
there's
lot.
Oh, they've been a lot. No, so we'll attach it to the,
It's
it's
Sandy's.
Sandy's, you typed it.
Oh, say yes, okay, oh, I'm sorry.
Remember
keep
like
going,
Karen
please.
used to give them
Yeah.
monthly?
Oh, yeah.
I'm gonna try to get that going
Yes.
again.
Please, yes.
So next flu season, we're gonna expand the flu vaccination clinics to underserved populations, possibly through Wakefield Housing Authority. Narcan was removed from the MPPH drug control program to some controlled substances. So provide better access to those who need it. We'll check with CVS and Walgreens where they're displaying Narcan. Sandy says she hasn't seen it on the open shelves.
She actually asked a couple of the pharmacy techs when she went into the different pharmacies, and they said, what? I didn't even know what it was.
I mean, we partnered with Pharmacy Nardone. We had a couple of years ago, we did a really great parent, concerned citizens meeting. It was very poignant. We partnered with another agency, but the CVS pharmacist came over and, explains that, so, it was then you could get it, you would write a prescription,
Right.
the CVS, it was like getting the flu vaccine, so same kind of thing. So it's just a lesson, and you just have to keep repeating yourself.
Yes.
Every 3 months.
For them.
Yeah.
And it is behind the counter. I mean, it is behind the pharmacy counter.
And
It's
are we
not out
still-
there.
And do we still have some in the health department?
Yes.
And how's the comfort level with that?
Yeah, it's not out in the open.
Well, it shouldn't be out in the open
Yeah.
because it requires training.
Absolutely,
It's secure.
But it should be, it shouldn't be that hard to get, but.
Right,
But, I'm just wondering what the cut, I know there's a disconnect, and I've heard this in other communities, like there's I work down in the Mass area, and it was an exercise that, we were all in it, we all had this understanding, but, there is a comfort level to
Yes.
it. And I just wanna, if there's anything we can do to help. be
well,
more
Sandy
comfortable.
is actually, gonna go out, and do a training
Yes.
soon, so, and I'm sure that she will be looking to train at the library staff, commonplaces that you might necessarily see a situation where someone would need to use Narcan.
Keep the wake up people involved, and keep Jason involved, just because
Oh, he
it's,
is.
it's
Yes.
Yeah,
a.
we touch base, Dave.
Awesome.
They had discussed, possibly Jason and Catherine discussed
Yeah.
working with the chamber to provide
Yeah, I
Narcan.
think that would be
you know,
pretty cool.
because the businesses all,
Catherine is
educational.
just, I'm sorry, she wasn't able to pop in because she was at a wake up event at the Northeast Folk, which is awesome, because they were doing a really good convention.
Or there's a regional group that meets for lunch every other month, I think.
Social services.
Social services, and Kara and Catherine hold it, and we brought Narcan there last time, and people could take boxes.
So camps, DPH regulations, there were slight changes this year. Sandy and Melissa will likely attend the Zoom meeting with DPH on April 4th.
No, I'm screening.
Oh, the screening, okay, so Sandy will be attending. And then
I live
meetings,
screening.
and then meetings with camp directors start April 9th.
I did not go to the ACA, but it was fun. You just get them accredited on their own.
I can tell you, we get calls, and Anthony's gonna need to call this guy back, who is a soccer coach, 25 years, and said, we've never had to do this. If we only hold the camp 3 days, can we not apply?
According to the regulations, any number of days counts.
Yes.
They got their regulations, and they're not, we didn't write them.
Yes, that's right. We'd be here for another 3 nights. Communicable diseases, they're continuing to monitor and they provide follow-up through Maven. There has been an increase in tick bite related diseases over the winter months.
Yeah, it just hasn't been cold enough.
Not cold enough to go outside.
For a couple months, flu was going up. It's sort of stabilized a little bit now. But in terms of other communicable diseases, they've been going down a little bit. We haven't had to work as many cases.
Then Cindy's preparing some articles for senior center use.
Anything, anybody? You got one?
No.
Okay, nothing.
Just that, I think that we should start to mention that, I think we owe a lot of gratitude and to thank Laurel for her, is it 13 years, Laurel, is beside you? 15, it is? Oh my God, 15 years.
Yeah.
Laurel came forward, at a time when we had a really difficult issue, brought out about our Board of Health. And her and I had ran the first year because we were
Outraged.
yeah, more than outraged, just a little shocked. that
We
that's
can fix
happening in my community, but I want to thank her at this point because we only have one more meeting with her for her dedication to us through thick and thin. There's been a lot of times when we could have walked out the door and said, see you later. Remember, we're elected, but we're elected on our own thing. Everything is ours. We do all our own work, our own
Pretty cool.
campaigning,
Oh, I
so,
know.
and standing with signs and.
I don't even see anyone there.
No, there's no more, no more. That's what she did.
But
But, I think, just to mention that now, we only have one more meeting with her. So I'll take the time to thank you for guidance and do that. We had all had our discussions and our yeses and nos.
Yeah, well, that's what we're here for.
That's why we do it. So
like
to thank her, I think that should be mentioned.
I almost broke it tonight with this phone.
Yeah, we can. I don't know. Yeah, we did one. I think we'll go to the next one. Not against me, though. I was always on your side.
Thank you. As a segue to that, we propose that you reorganize next meeting because I don't want to get called as the chair between our last meeting.
Are you afraid? Oh, yes. Wait a minute, I think that's in the bylaws of the health department. You cannot do it until after elections. There's that one. After elections, you do not.
Not in the bylaw, you don't have to do it ever.
Yes, it is. It's in the town bylaw because I have people come to speak at relay and we never can get the speaker until the chair is decided after town elections.
So.
That means we have.
Unfortunately, I think Elaine might be right on this one.
We organize whatever we want. You don't have a candidate. One thing if you have a new candidate. All right, you think about it. It's up to you.
But
Fine,
which
I'll
is
take a
very,
box
very
or
sad to say, I'd like to say in public that no one has an interest after everything we've been through the last 3 or 4 years. And people, saying they were concerned and opinions and hearing people's opinions. I was so excited at one point of listening how they were paying attention to public health and to the board of health and what we were doing. And I don't know what happened, but there was no one out there to come forward this year. And that
Well,
really
the process, as I know it, so thank you. It's been a real privilege.
experience.
And I've learned so much. So I believe what will happen is unless there's a write-in campaign, that town administrative, will put out a notice saying, just like we did with Candace, right?
Yeah.
So you and Candace would, and anybody else, from the department that you would like to be there. Hopefully, want to be on board with council, like the idea of doing public elections, but hopefully we'll get the consent. So, we've done it before, it's pretty good. Say, this is what we got, and if they know what they're doing, it's like, of course. It's not a vote, it's 2 votes. But the last time they deferred to us, as they should.
If we're gonna say thank you. I learned so much from both of you, but especially my first time as chair when I really did not feel well prepared. Your patience and kindness and knowledge of so much, including Wakefield, public health, being a nurse practitioner, all of it's been so valuable. Sad to see you go.
Also be proud.
From the board.
We're
Yes.
also in Maine.
I
We'll all be.
yes. But I'm excited for you for your next steps.
But there is something I would like to add to you, Mr. Chairman, that I do believe that on half now how we have 3 lovely boards, we had that lovely meeting, that on our next meeting, when we meet as a tri-chairs, that we bring in Cheryl Sabara from the
Great idea.
boards to come in and explain. But at that meeting, I also would like to invite not only the boards of health, I would like town administrators and town councilors to come in, because I think it's a learning experience for them.
We're gonna need like an auditorium.
The workshop.
Yes, this is a beautiful room. There's plenty of room right here. And you could even be on Zoom if you wanted to. You know what I mean? I think it's time that people learn because it's very difficult, as Laura will tell you.
they're reminded again.
Yes, they like to say, we're policy making, we're policy making, policy making. And a lot of people don't know it and things have changed in the last few years. And, people, you just have to, I think we have to be reminded, but I think it has to come and it also has to be known what they should and what they shouldn't do and what we can and cannot do. I think it has to be re-explained, because it's very difficult and it has changed. And a lot of boards of health have not attended the training for boards of health because they had to
We haven't had
postpone it.
any.
But now they're back and you can even go on Zoom, they have them all
Yeah,
reset,
that would really would be good.
which is
because
good. So
There's some.
it's just a
useful stuff.
suggestion, and I guess I will have the gavel next probably, so.
So we'll be doing it.
Yes, it sounds like- So you weren't just telling me, you're telling me. Okay, I got it, noted,
How do I tell you without telling you?
Yes.
Just have a lane say.
understood.
Just
volunteering.
Yeah,
Yes.
just telling you now, that's when the chair is gonna recommend that and it will be voted.
Oh, okay.
I know it will go through.
I should just start now.
Okay.
Okay, before we get too far off topic, just one more thing I wanted to say was, Laurel, it's, any number of years of service is impressive, but 15 years is nothing to sneeze at. Town of Wakefield owes a debt of gratitude to anybody who serves, but especially you, for looking out for their health. They're better for it. Been through some trying times, COVID only being the most recent. But serving on the Board of Health, it's a privilege to see you work. This is important, and the town is, they're better for all consideration put in their decision.
Can I add one thing?
Oh, my lord.
I know. All of the Board of Health people, public health people, I feel should, if you didn't see it, PBS is doing a special called The Invisible Shield. You know what The Invisible Shield is? Amazing, the first episode was last night, so I left the Stoneham meeting, came home to unwind, you're from 10 to 11, watch The Invisible Shield.
You're the only one that unwinds with this.
Anyway, it's amazing, you will watch it. There are probably, I don't know how many episodes there are, probably 4, because it's Public Health Awareness Month, but I was so proud of all of my colleagues and you guys in public health when I was watching that.
And also,
History reminded me of Ruth Clay, the history and how public health, the bubonic plague and so on, and then up to the COVID and science versus, yeah.
Yeah, and
you brought a lot to us with your clinical experience and.
well, but how I
Being
got
able
into
to say,
this is
okay.
exactly that. I was in the community healthcare lecture and they talked and we did, I don't know if it was a Massachusetts publication or a Nova or whatever, but it was a function of Boards of Health. This was 20 years ago. And I was like, oh, that's what they do. Well, and in elected positions, anybody can, by Massachusetts law, a dentist or physician of a but, so it's very weird with the township by Iowa. So if anything, I think we all want civics, right? There's a lot of civics in it. So like, well, I'm not. So proud, as I say, to anybody who listens to me, wait for this department has given more quality work. Bang for the buck, plus all of the grant stuff that has come in, it has been an impressive journey. We've gone from not being known to show up to any meeting to leading all of the meetings, and that is a nice history.
We went from being mentored to being mentors.
Yes.
Yeah.
That's true.
Totally.
So what?
We do need a field trip to the Public Health Museum, don't forget that,
Yes.
that's
Which one
included.
is that?
So that, the Public Health Museum is in Tewksbury.
Of the hospital.
Yes.
Oh, yeah.
And I encourage not only the inside of the museum, I got a real good guide, and then the outside to walk the grounds, and there also now is a cemetery tour, which I have not done yet, but I think Melissa and I are gonna do it this summer, so.
Yeah.
You can come and have.
All right, this is getting geeky now, but call me.
Come, you'll love it. And we can go.
Do I
for
have a motion to adjourn?
I'll make the motion to adjourn.
Oh, wait a minute, make sure that the next meeting is
Next meeting,
April
April
17th, am I
17th.
correct?
April 17th, 6:30.
6:30,
Yeah.
when will that be held?
Yes.
Oh, that will be also
We
here?
got this room.
I assume.
I love this room. It's beautiful. You look very relaxed. We can see you.
Oh, it's great.
Nice to
The
see
chairs are very
Chairs are
comfortable.
Those guys are the ones that-
Okay, I'll make a motion to adjourn the meeting.
I'm gonna second that.
All in favor?
Silver eye?
Hannah.
Book the line. We're done.